We interrupt our program to bring you this important message.
Warning. The following program contains explicit language and mature content. It is not meant for the easily offended. So if you are an emotional pussy, please refrain from listening. Thank you and enjoy.
Yes, sir. Right. Welcome back. The Words on Fire podcast. Got another killer show for you guys. This time we got the whole fucking squad again. Hey, that's like 2 in a row.
We're on a roll.
Something's ain't right, bro.
Something's gonna happen.
Right? No wonder the COVID came back fucking hard. That shit fucking taking everybody out like wildfire. You got my boy Jules, my boy Vince. Remember, follow us on the Instagram at the Words on Fire podcast, on the IG, thewordsonfire.com on the internets. Where else are we? We're on Twitter, supposedly. I think you're in charge of that, but I don't know if you ever use it. Do you even remember what Twitter is?
I just follow people.
You're one of those stalkers.
Son of a bitch. You see, we can't ever do that.
Hey, I
right.
do the same shit.
I
don't
just
post shit. I just watch.
what people have to say. That's
Yeah, all right. You're just there for the dialect.
Yeah.
I'm a watcher.
If you're watching us on the YouTubes, do me a favor, and there's a subscribe, like, hit, bell notification, all that shit down there somewhere. I don't know. I can never get it. People clown on me that I know because like I'll be like pointing over here and then the thing's over there, or I don't know where the fuck
Let's
I'm
just
at.
point different directions.
Just start pointing up and just wherever the fuck it falls. So this week we got a special guest. Oh man, so this dude's gonna have a little bit of everything. I have a feeling. Dude's a straight up cat from the 10 minutes I've talked to him already. He goes by the name of Erik. He has a company by the name of Diamond Hormone Replacement Therapy. You're a retired Army Airborne medic, is that right?
Yes.
All right. Well, first of all, thanks for your service. We should have had you on last week when we were going to do the pre-Veterans Day show, but
Oh, that would have been shit.
yeah, but timing and all that shit is just not my specialty. It's not my forte. Erik, what's going on with you, man? How you doing?
I'm doing well. Thank you for having me on the show today.
Hey, appreciate you coming on this onslaught. Seeing hopefully you could teach us, some of our viewers, some benefits about what you do. Tell us a little bit about the business. What do you do there? What's going on there?
So what we do is as we age, right? Men and women go through a certain thing. Women, as we know, go through menopause, correct? Men go through the same thing called andropause.
Right.
We just don't realize it because we just like attribute everything to age, correct?
Yeah.
Like I'm getting a little bit weight around the waist. You lose focus, that drive, that motivation. So that just some examples, correct? So what we try to do is catch the folks early on, men in this case. Bring you in, get some labs done. That's the first thing we do is get your labs done, right?
Yeah.
A hormone panel, an extensive list.
Okay.
With that, we get the labs within 24 hours. We have a consult for you within the next week, hopefully. We sit with a doc or a nurse practitioner. You go over your labs with them. And based on that, your past and what you want to achieve, your goals, the program is tailored to that individual specifically.
Yeah.
To help you achieve that goal.
Yeah.
Faster, along with not just the medication, but nutritional counseling, workout plans if needed, and we access the folks have access to us at any time if they feel that they need some guidance,
Motivation, foot in their ass.
Yes, there you go. Exactly. Yeah. So that's pretty much in a nutshell. That's what we do. That's more in detail, but we can get into that.
Okay, so you said a hormone panel, right?
Yes.
I guess evidently, how many different hormones are there in this panel that are being looked at, or like what does that entail?
So we look at for women, and I'll talk to men and women.
Okay, yeah.
For men, we specifically testosterone, right? Free testosterone, T3, T4, your thyroid, your cardiovascular system, your lipids, cholesterols, your triglycerides, the sugars. Extensive list, right, to make sure that, hey, if you're, like, say, example, you're diabetic, right, doesn't mean that you're not treatable. You definitely are. It's just got to be tailored differently to you,
right,
based on your condition at that presented. Now with that, with the treatment and lifestyle changes, with your diet, your exercise, your sleep, most times that goes away, right? So we just help identify that early and make sure that the plan that we're giving you is what you need to achieve that goal.
Okay. And then for the women, you guys do
same thing. We do. We check their hormones as well.
Right.
Estrogen, progesterone, testosterone as well. And believe it or not, a lot of women do testosterone more either the pellets.
Okay.
Or the topical, the creams, right?
Uh-huh.
And it's just absorbed differently. They have a very, very small amount of testosterone, but it does help them achieve, the weight loss at the same time keeping that lean muscle mass.
All right. And then for the guys, say you go through all that, you say, all right, dude, you're really like your testosterone's gone, like you got like empty nuts, right? So for that, like I know everybody's program is different. Everybody's medication is different. The majority of the medication, other testosterone, are those all injections? Are those pills, creams? Right. Well, what's the majority of it?
We do all injections, the cream, pill, or pellets. Right?
Okay.
It's just everybody's different. Some folks like injections, right?
Pellets like rabbit food and shit.
You could look at that way. I mean, they're very, very tiny.
Oh, okay.
And they look just like it, just a very small version of it that are inserted, in the glute. Either every 4 or 6 months. So it's a one-time, invasive procedure with a big needle, and that's what it is.
Oh, fuck.
And it's inserted, and you don't have to worry about it for
Had
6
me
months.
worried when you say insert and shit.
So it's like there are people that opt out for that.
It's just it's a procedure that's done one time every 6 months. You don't have to worry about injecting yourself once every week, or the lotions, which are very
Lotions.
you got to get out the shower, correct, right? And you got to put it on, dry yourself in the thighs and the shoulders. Make sure it's dry, completely dry, before you put any clothes on. Because you put the lotion on, it's still wet. I mean, it's no purpose because then the clothes
Absorb it. Yeah.
Correct. That's why injections and pellets right now are the big thing that it lasts longer. You bet the effects are better.
Okay, yeah, because when you say you're gonna put the cream on, I was like, wait a minute, you don't go straight to the main vein. You don't go straight to the winning
I'm gonna
point,
take care of this real quick.
right? The baby, that's the 5th time you use that cream today. I'm trying to get right for you, girl.
I stay ready.
That's right. That's right.
I gotta make sure we good. We gotta get along on this motherfucker. We got 18 years left. I pay that child support.
Absolutely.
So I know. So what else? So with the hormone, besides the shot, the testosterone, what else do you guys offer there? 'Cause I know you have like the age. Was the age rejuvenate? I can't even say it. I ain't even pronounce.
Yeah,
There you go.
That one.
That one where you go
long
back
word.
in time and shit.
Yeah.
Hard word.
The hard work. Yeah. So what else do you guys do there?
So we I guess testosterone therapy, hormone replacement therapy is one, right? That's our big one. Weight loss, for example, right? Some people just have a hard time losing weight.
Yeah.
So we have other medication that's all pharmaceutical. It comes from either Houston or Florida.
So their mouth shut, man. Don't eat, motherfucker.
Yeah, that's the big one, right?
Quit eating, son.
We have some medication. I'll give you an example, like phentermine, for example. You heard of that one? What it does is it's like, think of meth, right? It increases your heart rate.
Holy shit.
Holy shit.
A lot. This is why it's prescribed, and it's in 45-day cycles. It's because of just how hard it is on your body. So we do 45-day cycles and make sure that this is where you start, and we weigh you every week to make sure you're on
pace
to get to your goal, right? But not just a pill. There's also, like I said, the lifestyle, right? The nutritional counseling comes in place. So we have a nutritionist that sits with you, and it comes up a meal plan for you daily, every day, 3 to 5 meals.
No Snickers or nothing like that.
No, none of that.
What about those low-fat Snickers? that dark chocolate. That dark chocolate is good for you, dog.
I wouldn't know, man.
That dark chocolate is good.
I will
for
eat
you.
that chocolate.
So what's the purpose of like raising your heart rate? Like, what is it supposed to actually do? Like,
Increase the
obviously
metabolism.
you can't just take this and then just eat like shit,
Right.
You know what I mean? So
Right.
it's like what? I guess how does it go together?
Hand in hand.
So it increases your metabolism, right? You increase your heart rate like you do any cardio, right? You increase your heart rate, you increase metabolism, that fat burning, right? So that's what it does. It helps that metabolism, that heart rate to speed up. Pretty much just breathing, right? Hence why it's so.
So kind of like a substitute for exercise.
It is. It is.
I'll take 3.
But you take one of those. I mean, that pill is so tiny. So tiny. You
I'm
like,
exercising right now. Sleeping.
Feel the bird.
Yeah.
Feel the bird.
yeah.
So for these medications that you're talking about, I know some of the people, a lot of it is like, it's cool, it's different. Will people piss hot on any of these medications that you would prescribe to them?
No. They're like it's totally legal.
Yeah.
Right. And everything's prescribed. So if for some reason
Something pops off.
something pops up, you have your prescription and the note from the doc that you're not doing this illegally.
Right.
Look like a Christmas list. It's like,
Right.
Is that what?
I got you.
Why is weed on that shit?
Yeah, can help you
Looks
there,
like
man.
one of them CVS receipts and shit. You know how they give you all them coupons?
Oh shit! So I know I was talking to you earlier about peptides, right?
Mm-hmm.
How do peptides work? Because I know one of my homies here. He's had a bad. What is it? Your hammy?
It was my hamstring.
Yeah. Your hammy's been fucked up. And how do peptides work? Because I know we've talked about him, and I've been different stuff that's out there. What are peptides and how do they work?
I'll use one as an example right now that we're dealing with right now, which is a big deal. HCG, you know what HCG is? So it's a hormone, right, that really women produce while they're pregnant, right? Helps them with produce the milk, right, for the baby to grow, right? So men, when we're on testosterone therapy, right, we're introducing this substance from an external source, right, the needle, correct?
Yeah.
Or a pill or pellets, right? So what happens is our testosterone increases, at the same time our estrogen increases, right? So we have to, that's what we have these other like estrogen blockers and anastrozole or some others, right, to help minimize those negative side effects that we want, right? So HCG right now is off the market. There's some like legalities behind it with these pharmacies that were compounding it illegally, my understanding, or not illegal, but the wrong way.
Okay.
So now they've changed it to peptide, right? Like you said earlier, kisspeptin, right? That's a big alternative right now for HCG. So it works the same, right, as the the hormone that we produce naturally.
Okay.
But it's just a compounded kind of mix. So this helps us with our recovery, our growth, or sleep as we're on our therapy.
Okay.
Do you guys offer peptides?
We do.
You
Yes,
do?
yes.
Oh, which peptides do you guys offer?
We have a catalog. So we have to look at it, right? And again, when you the individual speaks to the doc, that's when that comes up, and you can decide what you want, and then at that point it's just prescribed to you.
Yeah, because I just barely got off. I was taking CJC 1295
Yep.
and Epimorlin.
Yep.
I was taking that, and I just got off maybe 2 days ago.
Yep.
And to me, it felt like it worked.
It works.
Because there was another peptide, I forgot what my doctor suggested, but that's basically after your injury, like when you're recovering right after, because my injury happened 2 years ago.
Yeah.
He's like, at this point, your hamstring is gone. So this is the only thing that you could probably do is like get the muscles around your leg
Stronger, right?
to get stronger. And that was my thing. My thing, like before I was able to lift heavy, like squat wise, my legs. And then after the injury, and then with COVID, and then I couldn't go to the gym.
Yep.
So my legs just got weak.
Yep.
And I just needed that boost. Like I needed like help.
Yep.
Because at a certain point, like I would squat down, my knees started hurting and everything. Like I'm never gonna get that weight back.
That's age,
Yeah.
buddy.
Yeah.
Welcome to the club.
So he told me. So
Now you're a dad.
He told me to opt in for that CJ C 1295 and Epimorlin because that's basically to inhibit more growth hormone.
The growth.
Yeah.
Yep.
To for the muscles.
Right.
So like I tried it. I think it was for maybe like a month. It was a month.
Yep.
And that I tried it. That was my whole routine, and yeah, it helped out. It helped out like tremendously.
We have a big one right now that we just began prescribing. It's Sermorelin, right, which works together with Sermorelin, right? And it helps, and that you can do that pretty much as long as you want. You don't have to cycle on, cycle off. I mean, obviously, folks do it right, and you do it for cycles, right? Cycle on, cycle off, right? Because this dose is so small, and you do it every night before you go to bed. That's when our growth hormone is. That's when our body produces the growth hormone. So we're just helping that. You can do that as long as you want, right? So that's something that like you for example, you just came off of that, right? You can start on some Sermorelin at a small dose, but it helps. What you've already, the muscle you've grown already to help around to stabilize it, to help them make stronger. You continue that the entire time to continue. You don't lose any of those gains per se, right? Yeah.
See, because I know when you were telling me about the stuff, I was under the assumption like it would help like regrow it as far as for like the damaged muscle, but I guess it just helps it get around it, like help everything around it, strengthen it.
No, because it's how I said it. Because in my particular case, it's weird because the fact is that when I tore my muscle, I didn't tear it at the ligament. My muscle was torn, like the actual just muscle was torn. It was torn in half, and I waited so long to try and get surgery. What my doctor basically told me, my orthopedic doctor told me, was that try to imagine like getting ground beef and getting a hook onto that and try to attach it to ground beef at the bottom. It's like, it's not going to happen. It's like your muscle's gone. Like you waited too long to try and repair that.
So you're
So
fucked.
yeah, so basically, is the best thing that you can do right now is to opt in for peptide is to grow the muscle around it. But there's a different type of peptide. I forgot what it was called. That it's basically for injuries. So like right after you, there's some doctors that prescribe even right after surgery to help you recover a lot faster.
Okay.
And I forgot what that peptide was called, but even the CJC 1295 and epimorelin, if you were to take it right after surgery or right after an injury, it would help you. It would have probably helped me a lot more back then if I had taken it right after my injury, as opposed to like 2 years later. You know?
Of course. Of course. Yeah.
Yeah, I mean, you had important shit go on. You know, you can't walk and shit, but I mean, fuck it. You know, you got to go clubbing.
There's a big one that we have as well. It's DECA. You heard of DECA, right? So it helps. Obviously, you folks that just can't put any
Well,
weight
DECA,
on.
that's a steroid, isn't it?
It's a steroid. That's a steroid, right? But that's why those are. It can be done as well, but it's that's a cycle, right? 8-week cycle, and you stop. But it helps with folks with joints. It's a joint lubricant, so it really helps. You know, like your knees, for example, right? Shoulders, back, hips. That's
Gout.
Yeah, no. But there's so many things out there, and I'm using that example, right? Like you said, the peptides, the growth hormones, these DECA test, all these things, they all have a why they work, right? So it's not just given to you because hey, you want to get big, here you go, right? No, it's make sure you're being monitored by the doc, the provider. Every 6 months we do we bring you in, do some lab work again to make sure that you're where you should be, not above or below, right? Some people have some reactions, right? So I'll use an example. B12, right? You do B12 too much, for some reason it interacted with testosterone and it dropped his testosterone. So we had to stop that and increase his testosterone levels to get him back up, right? Hence why we do this every 3 to 6 months, the labs, to make sure that you're where you should be at your high, at your 1,000, for example, for your testosterone level, to make sure you're performing at your optimal level, right? Your performance. And some of us work in those fields where you need to have that performance, be performing at all times, right? Yeah. So.
But no, my porn career is gone, so I can't.
Right.
Yeah, the weight took that shit.
Perform every 6 months.
Hey, give me a shot, give me a pellet for every fucking 6 months. Just make sure we get this shit going. So let me ask you this, because we probably should have led with this. Why was it important for you to open up something like this?
Okay, good. So I retired out of the military in March after 21 years, right? And my entire career was in special operations up until the last 4 years. Where I needed to take a little break, right? Yeah. So in that type of organization, we had to always be at our physical, right? Had to be peak, right? But during that time, I was younger. I was able to eat well, sleep well, work out, and had everything there at my disposal with an organization, right? But then when I left that, I was 36, 37.
Damn.
And that's when I noticed hey, I'm not doing the same thing. I wasn't active as as I was in those organizations. I was more at a desk, more administrative at that point. So I noticed that's when I started gaining weight. That my drive, my motivation, just you name it. Everything we talked about before when we first started, that was me, right? So I was like, I need to do something. So I know I saw some military docs, and they're very hesitant to prescribe testosterone. So I did that for 2 years, and that 2 years I was like, no, this is enough. I'm not getting any better with even what they were giving me, which is some other medication. And I would bring it up to them. They were treating, the number versus my symptoms. Okay. Right. And so I got tired of that, and I went to go to a clinic off-site, and that's when I did the labs, as mentioned earlier, and that's when you're like, yeah, you're definitely treatable based on your labs, right? So I jumped on that opportunity, because I've done, like we all do research, right? Right. Make sure that I'm getting to something that works, not just some stuff that we see on TikTok or something. Yeah. So I did my research, and I jumped on the opportunity when they said you're treatable. So for the last 4 years I've been doing it, and I feel great. That weight came off, my motivation, just the strength, the vigor, right? That aggressiveness that we need. I got it all back, and then now we have our little boy, 6 years old. Yeah. He's a ball of energy, right? So I got to be able to maintain, keep up with that guy, right? Because if not, forget it. It's I don't want that for him. I want him, hey, Daddy, I want to go play soccer.
Yeah.
kick the ball
Just take a
around.
nap first.
Yeah, yeah. I mean, sometimes, but so I wanted to be there for him and for my wife, right? Be there, like, be that energetic person that we want to be, right? So I got out and because it did so much for me in those 3 or 4 years that I was on it. I'm like, I need to do this outside, because especially for and I speak to myself, I'm a veteran, right?
Right.
And I know what it did for me, and I know a bunch of military folks that are going through the same thing now. I'm speaking to a lot of them that just have that hard time having a doc prescribe them, this medication.
Right.
Right.
Yeah.
So I came out and I got with some folks, and that's pretty much what happened. I pitched them the idea, and in El Paso, there's some little clinics that are out there. But there was one big one here which is on West Side El Paso. That's who I am with right now. I'm partnered with them.
Okay.
Here in El Paso, but I was like, why aren't you on the East Side?
Yeah.
There's El Paso East Side is so
huge.
big. It's big, right?
Huge.
That's a big audience out there that potentially wants to get, but they don't want to drive to the West Side because it's so far away, right?
Yeah.
So we agreed. They were on board, and that's how I came over here to the East Side.
Okay.
And opened the clinic, Diamond.
Yeah. And the address for those that are here in El Paso, what's the address at the East Side location?
East Side is 10940 Montana, Suite A, 79936 zip code.
There you go. So why do you think the military is so hesitant to provide the hormone therapy? What do you think it is?
I don't know. I just from experience, the endocrinologists that I've spoken to just don't really specialize in hormone therapy. Okay. Right. And the one in San Antonio, we had one, but then she left. As soon as she left, they cut off my the treatment was like.
So they just cut you off. They had you on it, and then they just
cut me off, just cold turkey, right? Which is not how we want to do it. You usually want to kind of like
wean off,
right?
Yeah.
And that's not what happened here. And that's when again, these symptoms that I developed, just like, dude, it's not. We treat again. When I say treat the symptoms, not the number, right? Because your number can be 350 to 950. That's the normal range for a man with testosterone level, right?
Yeah.
So if you're within that number, you're most docs won't treat it because you're like, you're within normal ranges, right? Yeah, I'm within normal, but my symptoms are telling me otherwise, right? Like this is how I feel, right? Treat that, not the number, right? Because that's
right.
I want to feel like 100%.
Yeah, you want to feel like yourself,
right? Like myself, right?
Yeah.
So that's why I think docs are very hesitant, and military docs are hesitant. It's just because that's not their specialty, right?
Do you think it might have like a little thing to do with also like the history with military and PTSD, and then you're adding testosterone to that?
Perfect.
It's like pretty much amplifying the aggression. You know what I mean?
Perfect. I'm glad you said that. So there's been studies on PTSD and testosterone use, and how actually it's the complete opposite. What you said, it actually is beneficial for the individual it may be going through PTSD, right? Testosterone therapy, because the op tempo, now military again, or anybody that works in law enforcement or that type of field, right? Your op tempo is very high. You work 12, 16, 24-hour days, right? So you have the stress, the anxiety, the depression, all these mix of emotions, right? So with that, it takes a toll on your body, and hormones is one of them, right? So your hormones are going out of whack from the constant deployments, the go all the time. So to folks that have gotten testosterone, they got the therapy started. It's actually shown to help them improve their state. Those are folks that are PTSD with testosterone therapy. And
obviously, I would think that would be like an older soldier as opposed to like someone that's like in their 20s, right? Or
so men at 30, we go, like I said earlier, we go through andropause at 30, right? So most of these folks, soldiers are 18, 20 years old, right? And they deploy, but as we go through multiple deployments, and now it's kind of lessened the amount of deployments, right? They're still out there doing things, right? But the up tempo, like with Iraq, Afghanistan, for example, I'll use those as an example, right? We were constantly gone, right? 12 to 15 months, or come back for a couple months, be gone for a few months, and it was just go all the time, right? So I wouldn't say for older folks, but it just depends on the individual, right?
Right.
But 30 is that's like the sweet spot right now. That the research says 30 to 60 is like that sweet spot where that's when we lose 1% of testosterone every year after 30.
Oh shit!
Yeah.
Damn, dog, you on? We running on empty,
negative.
guy.
I'm on negative
2%.
We running. I owe some shit.
No, but I ran into that where I get my testosterone tested, and they told me I was in the normal levels, and
Yeah.
I was like, I'm not normal. Yeah, I don't feel normal.
I'm anything but.
Yeah.
So Eric, how old are you now?
I'm 41 now.
Well, no, so you're so young though.
Yeah.
Damn, I was hoping you'd be older than me. I was like, fuck yeah, I'm gonna do this. I was like, oh, this is a young buck, motherfucker.
You guys are all young.
You guys are all young. So let me ask you. So say if I were to go in, I get my lab works and say this is what we need to get done, right? Is there different programs that you could get on and be like different amount of support? Is there like because I know like you're talking about stress. You keep on mentioning stress a lot. Mm-hmm. Is there anything like psychological support that they get also with that to help them manage the stress, or is it all just more speak to this counselor, speak to this dude, this is the nurse practitioner, and just pop your pills?
So in our clinic, yes, right. It's specifically just nutritional counseling, the medication, the physical, the workouts you need, right. That's what we do. Our doc though and nurse practitioner, they're access. Any patient that we have has full access to the doc or nurse practitioner at any time. So if they feel like you mentioned just now, they can definitely call and we'll set up a consult with them. And it's all tied together, right? And then they'll sit down and talk to you like your PCP would, right? And if they feel there's something more like that's going on, then you can either make a different appointment with them for that, or they'll recommend you to go back to see your PCP for whatever they feel you may need some work done for that. Okay,
and do you guys have like a workout equipment on site?
So at my location on the east side, Diamond, we don't. We do have a gym co-located right next to it, which is you can throw a rock at it.
Yeah.
And they're on board with us, so any patient of ours has full access to that gym, and actually two gyms. One's a little mile down the road.
Okay.
That have full access to either of those gyms at any time.
Dope. And then you get your own personal specialized workout, right? And the majority of that, is that like based off of cardio, or is that based depending again case by case?
Just on your goals.
Yep. What your goals are. If you want to just put some lean muscle mass on, obviously you're gonna throw in some resistance training weights and cardio. I mean, cardio I think is always it's a requirement.
Yeah,
you need that, right? Some of us don't like it. I'm one of those. I hate doing cardio.
Right.
So I just move heavy weights from there to there, right? And
I'm in the arm circles. About as crazy as I
circle
get.
jerk.
Yeah.
Do the circle jerk.
But
I'm good with the warm up.
I'm good.
Right.
I'm ready to go.
So when you're in the service, what was it that you were doing when you were in the military?
Right, so as you mentioned earlier, I was a paramedic my entire career. Up until now, even I'm still current now, right? I was a medic within Ranger Battalion for about 7 years. So I did a lot of deployments there with those guys. After that, I stayed within the special operations community and did other things deployed to all over Africa, all over Central South America for different missions, right? But they were all in support of, us here in the States, right? Protecting here in the States, right?
The homeland,
right?
Yeah.
So I did that for a long time, and I've been as a medic my entire career, right? We did either it was in combat as with my platoon or my folks out there doing missions. When we did our Africa mission, it was more of a kind of help stability operations, kind of helping them build up their areas. Central South America, what's the big thing down there is drugs, right?
Yeah.
So that was our mission down there, right? So it were very different missions, but at the end of the day, my job was to make sure that whoever I was with, my folks came back home.
Yeah. So what's the craziest shit you ever saw when you were on one of your fucking deployments?
That you can say.
Yeah. Remember, we got black ops. We're level what classified or how do they say in the movies and shit?
I don't know what the fuck you're talking about. I don't know what the fuck
We're the Jason Bourne of podcasts.
Right. And one example was we had a mission at the Syrian border. My platoon and I, we got inserted via. It's open source. It's in a book, right? So I can disclose this.
Sweet.
It's documented.
Yeah.
Right.
Yeah. We landed from Chinook. As soon as we were coming in and filling into the drop zone there, we would see gunfire going off in the sky. We could hear it. So we hit the ground. Everybody just came out of the bird as we do in training. Started just lasing folks, taking them out, right. I mean, as a medic, I'm always towards the front of the helicopter. Right? I'm the last one to come off that bird, so I can come from the rear and go identify those individuals if they get hit. Right. So as we got up, the guys are doing their thing, taking some folks out, and then at our very like 12 o'clock, about 200-300 meters, there was this big, fire. We could see the fire, like what's up? So we went in that direction, right? Because that's the way we had to go. That's where the entrance to this little wadi, this little trench was at, right? As soon as our point man, Alpha team leader went around the corner, within minute, 2 minutes, you hear this big bang, right? Just loud. And we heard, all I hear is a high pitched sound. So I'm like, oh, it's a woman. There's a woman back there, right? And then seconds later, what do you hear? What's that? Like, as a medic, that's like the worst thing. I don't say the worst thing, but that's what you're trained for, medic, right? That call for medic came out. So what do? I just run, right? That's me. It's my turn, right? That's Q. So my platoon sergeant and I just ran out there. I went around to the wadi, to the left. His team were just laying down suppressive fire on the other side of the wadi. Some combatant on that side, and just laying scunion on this guy, right?
Yeah.
So at that time, that allowed me to get to him. We're still taking. I mean, I can hear the
rounds going through.
Just hitting behind me in this little trench behind me, right, the wall. So these guys are just laying whack on these guys. One moment, there's a grenade came at us, right? So the other thing I could do is, as again, training takes over, right? I just jumped on my patient to make sure that he was fine, right? So I shielded him with my body. Grenade went off. These guys just started, again, just laying suppressive fire on that area across the field. I got him packaged up. What happened? He got hit by an RPG. That was a big boom, right?
Fuck.
RPG hit him, took his leg out. That's the first thing I saw was with our nods, right? Our night vision goggles. I can see that. Hey, you're missing a leg, right? So,
yeah.
So I get on there real quick, do what we gotta do. Immediate. The life threats is his leg and arterial bleeding, right? So I was down there, got the tourniquet on place, secured that, made sure that the bleeding stopped, right? Undressed him, do what we have to do as we're doing our checks on the body,
right? Make
sure there was no other
impacted places,
any other like life threatening injuries,
right? So
I did that, packed him up. I got a skedco. If you know what a skedco is,
what is that?
So it's a litter, improvised litter. So you roll it like a burrito. Think of that, right? So what you do is we unroll it completely, and then we just lay them on the skedco. So now it's flat, right? And then I just tie him up to that, secure all his equipment, put him on the skedco, and we hauled him back to where we came from, from the bird, right?
No.
But during that time, man, it was the thing we gotta do is like we want to make sure that we don't want to lose our patient to lose consciousness, right? Because lose consciousness now, like, is he breathing?
Right.
That's another thing we have to worry about, right? So I'm like, hey, I'm gonna mention his name just and like, hey, make sure you tell me the ABCs. You finish the ABCs, and I'm like, okay, count to 100, and he's counting 100, and he's like, fuck, doc, I'm tired. What am I what am I counting for? But it's for me, right, to make sure that he's still breathing and is still with me, because like I said, if he stops breathing or stops talking or counting, that's a completely different scenario, right?
Right.
So that was, I mean, to me, that was the I think my first real like injury or casualty that I had, and that's why I think is the most impactful for me. Even to this day, he and I still birthdays and everything, we still talk to each other and
saved his life,
yeah,
bro.
But that was my first one, and after that, I mean, it was other events as well, but that was, to me, the most impactful in my military career.
So when you're out there, I mean, you just have like the basics, right? You don't have like all this high end equipment with you, right? Is it as ghetto as
you got an MRI?
You got duct tape. You got
a MacGyver shit.
Yeah, I mean,
got a pencil.
So it helps that you're a beaner, right? Because
you improvise,
right? You got like a scuba gear, fucking snorkel, fucking duct tape, and an avocado,
and you're good.
And a hammer.
Yeah. So now you got to save this dude's leg.
Yeah.
Damn, that's fucking crazy. But so, what is it about the medical field in general that got you involved into that? Do you like just the fact of helping people, or is it just the body? Is it just intriguing, or what got you that way?
You're talking going as a medic? So you're talking
yeah, going into the medic way.
So the way my career started was right. So I went to NMSU for a couple years. I was my second year, kind of just started fucking off, right?
Yeah.
Not doing the right thing, more partying and not doing the right thing.
Right.
You know, long story. Right?
Yeah.
So
Living college life.
yeah.
As we all do.
So my pops was in the military, and he's like, hey, you gotta do something right. Like you're going down the wrong path, right? So he kind of got me going. He's like, we're gonna go see a recruiter.
Damn.
We're gonna saw a recruiter. And,
You're going down the wrong
Yeah,
path just for
yeah.
partying?
Right. it was a multitude of things, right? But
It was
that was the
college
start of it.
partying is what it was. It was college partying. That's
Oh, you know, it just gets worse.
Yeah,
gets worse.
Yeah,
Yeah, it gets
that's how
worse.
I ended up there.
You got to stay away from NMSU. That's what it is.
So you're saying go hang out there?
yeah. There you go. And then so he took me to a recruiter. We spoke to the recruiter, and he was like, so you take your ASVAB. Took my ASVAB. He's like, you qualify for XYZ jobs, right? And neither one of them were intriguing. Like, no, that's not what I want, right? Then one came up. I was like, pharmacy tech, I think it was. I'm like, I'll take that, right?
Yeah.
My plan was to do 4 years and get out, right? 4 years, get my shit together, get some school money for school, and then go to school, right? That's not what happened, right? So I got there, I signed a contract, got to MEPS, and then they're all telling me like, hey, sorry, there's no more slots for pharmacy techs, but we have fueler or infantry or something else.
All the shit work.
Yeah. And I'm like, no, man, that's not what I agreed to, right?
I'll just be a surgeon.
So I'm like, just give me a call when you have something in the medical field open again, right? So a day or two later passed, and then I get a call again from the recruiter. He's like,
They
hey,
don't let you walk out.
right, yeah, it's all numbers, right? And he's like, hey, we have this combat medic, slots open. You want to take it? Sure. I mean, I didn't hesitate. It was in the medical field. I did again my work. This is what you get out of it, right? What certifications do you get out of it that can help me
In the
on
real world,
on the outside, right?
Right.
So I'm like, I can do that. It was an EMT and some other little cards, right? So I got there. I got to basic at Benning. I saw my first drill sergeant there. This Filipino guy, stocky dude. He had a Ranger tab, and I'm like, I'm like, this dude this is what I want to look like, right? He's got his triple stack tab, and just a stud, man.
Right. What pellets you taking, guy?
Yeah.
What pellets you got in that ass?
What rabbit food?
Yeah, and then so I was like, that's what I want to do, right? And I talked to him for a while. I talked to him the times that we could, right? He kind of showed me that he kind of instructed me what to do, right?
Okay.
So from there, I went to Fort Sam Houston to start my healthcare specialist combat medic training. And when I was there, I saw another drill sergeant just squared away, who's now is command sergeant major of like an entire region here in the States.
Oh shit.
I saw him. He had his little maroon beret, and his nice shiny boots, and I'm like, what's that?
Yeah.
Right.
Yeah.
And that's when he pulled me aside. He's like, this is airborne, private. Right. So I'm like, what's airborne? And he told me what it was, and he's like, if you want to go, you let me know, and I'll generate a 4187 to get you to the school. Okay, I'll do it. So I did that. That my orders for Germany got canceled, and I went to airborne school and back at Fort Benning again. 3 weeks of that, that's when pretty much you learn how to fall like a sack of shit out of an airplane, hit the ground hopefully in one piece, right?
Yeah.
And not break anything. But I did that for 3 weeks. While I was there, same thing. We had this Ranger instructor from the Ranger Indoctrination Program came across, and they're trying to recruit folks for Ranger Battalion. Came across, and he's like they look sharp, right? Just lean and mean, as they put it, right?
Right.
His black beret and just tough dude. And they explained to us what we get out, and as a medic, we would be able to attend special operations, combat medic course, get our paramedic, and then get some other little wazoo stuff, right? So I'm like, yeah, that's me. That's what I want to do, right? So, I did that. Went to RIP, made it through RIP. Just got our ass whooped for 3 weeks, man. That's what it was. Just an ass beating. That's all it is, right? And just the mental game.
Yeah.
We made it through that, finished, and then got my assignment to go, or my orders to go to the school, the Special Operations Combat Medic Course.
Okay.
Which is where all the Ranger medics, all the SEALs medics, the Green Beret, the 8th and Deltas, the 160th medics. It used to be the pararescue jumpers, the Air Force PJs. Used to go there, and the Marine Reconnaissance, right, medics, the corpsmen. We all went there, and it was a 6-month course then. Now it's 9 months.
Damn.
6-month course, very demanding, and it's very quick. A 2-year paramedic course in the civilian world is 2 years, right? this was 6 months, so you used to shotgun blast, just drinking through a water hose, right?
Yeah.
Or a fire hose, just coming at you. And we made it through,
Yeah.
We made it through, and after that, got to, I was able to come home for a little bit, about a week or two on leave, en route to my first assignment, 2nd Ranger Battalion at Fort Lewis, Washington. And then within, like 3 weeks, my platoon was already in Iraq. So within 3 weeks after I got there, he's pretty much got all my, all my equipment, my room, kind of got situated a little bit. Then like, boom, you're on the bird, and then got to Iraq. And after that, it was just go. Up until I finally decided to hang it up.
And what year was that when you first deployed?
I was in 03. Yeah, August of 03.
Damn.
August of 03.
Fuck. Yeah. Can't remember what the fuck I was doing in 03. I know it wasn't no go shit. I don't know. I was still fucking partied.
There you go.
Yeah. You were at a go-go bar.
I was at a go-go bar,
That's
right?
the only go-go you were doing.
Damn, do you go from fucking partying and getting yelled at to fucking being shot at?
Awakening, bro.
Yeah.
Right,
Yeah.
damn. So
But it helps you like understand, like
what, the party?
no.
No, you know what you can go through.
Fuck
Yeah. You're the person, individual. Your mind. You can put yourself through anything if you. Again, at the end of the day, I wanted to come back home. I wanted to make sure my boys came back home, right?
Right.
That was me or them, right?
Yeah.
You do what you got to do, unfortunately.
Right. That's fucking crazy. See, again, thank you for your service. 'Cause I can't imagine that shit. I can't do that. I can't stand people
that's
yelling
tough,
at me. Shit, fuck that. And then there's an exercise thing.
Hey, boot camp's a rude
married and
awakening,
shit.
bro.
Right?
Yeah.
I'm barely managing right now. Shit. And I didn't do shit all goddamn day, but it woke up.
As soon as you get to the airport, man, they start fucking just being assholes.
Yeah.
Yeah, they're cool. Why they're recruiting you and be like,
fuck.
it's gonna be good. Man, you get to the airport.
No. You makes you like thinking like, is this really worth it?
Yeah. Because you did what, Navy, right?
Yeah.
Oh, yeah. No, yeah, you guys suck. You guys ain't no airborne and shit.
No,
man.
no,
Y'all jumping in the fucking
no,
pools.
No. I was no SEAL.
That wasn't special.
No, I wasn't special at all.
I was just a seaman.
Shit.
An airman.
There you go. Specify it. Damn, that's fucking nuts. But that's crazy how you're able to go from that crazy shit, and now you got to deal with this shit. Now you're on the front line to kind of, again,
But
the
it kind of
hormone
explains it. You got to
therapy,
turn
though.
it off and on. And some people can't turn that shit off.
Absolutely.
Yeah.
Absolutely. Yep.
That is fucking dope. So, I'm trying to see what else I got, because there's so many fucking questions that I got. But I'm still kind of fucking asleep. Like I said, dude, this whole workout thing, waking up thing ain't for me.
Yeah, you tired, huh?
Yeah, fuck yeah. I'm old.
Now, what's
That's
your
he's
regimen?
He's gonna need a lot of help.
I'm gonna need like 3 pellets.
Me too.
He
need
wants
some
a fucking
shots.
miracle pill. He wants a miracle pill.
Yeah.
I need that.
What's your
24
regimen?
hour.
Like, what do you take?
So my regimen is testosterone. I do 20 milligrams once a week. My anastrozole for the estrogen blocker. Right?
Do you do injectable or do you do like the
Inject-
lotion?
No,
shit?
injection.
Injection. Okay.
Injection. I do myself because my wife is afraid of the needle to,
What's injection at? Do you do injections throughout, or is it like is it on the ass?
Throughout.
No,
Right
because I know like my daughter has to do injections, and she has to do arms, stomach, or butt.
Yeah.
So it's got to change throughout that. Every day, it's a different region.
Yeah.
It's either glute or shoulders, and you have to rotate it. So you yeah. So if I do the glute, I go from left, right,
Right.
every week. Yeah.
Yeah, so you're trying to get that fat ass.
You know what I mean? Without
You're trying to get that fat
You're
ass.
on that Nicki Minaj type regimen.
Oh, shit. That's a fat
So
ass.
you take tests?
testosterone, and estradiol for the estrogen blocker. It helps with the gynecomastia, that estrogen, the bloat that we, and then HCG, right, which helps is stimulate your pituitary gland, right, to help your testes produce testosterone and keep your sperm count up. So I do all that. The 3 keeps your nuts from shrinking, right? But like I said, now ECG is no longer on the shelves anymore. But we have the peptides, right, kisspeptin or enclomiphene or Clomid, a variety of different alternatives for HCG that serve the same purpose.
I'm not trying to get no one pregnant. Fuck that.
I try to get this.
Right.
Shut down shot, bro. Fuck that.
Yeah.
I want my shit dead.
You work, but not those.
Yeah. Oh shit! Because I really, like I said, like we were talking about earlier. Like I really want to go try this. I really want to do this because I feel I'm at that point in my life where I'm fucking. I feel older than my age.
Right.
That's not fucking good.
No,
you know what I mean? My drive to do certain shit is. doing a podcast alone, I feel like exhausted and shit. Like I'm done. I'm like, fuck. That's we're just sitting here talking shit.
Yeah.
You know what I mean? At the end of that, I'm sweating and shit.
I think I could do shit, but I can't do it physically. I'm like in my head, I'm like, yeah, I could do that shit. Nope, can't do it. Not anymore.
No.
I could try though.
Yeah. I'll give it the good college effort, but I ain't going. Don't expect much. So.
Yeah.
I'm gonna fail hard.
I was like back in the day,
right? Hey, you gotta caught my shit 15
You're lucky
years ago.
You caught me this point in my life.
Oh shit. Yeah. So you're saying that there's a weight loss pill that you guys pop out, right?
Yeah, like I mentioned earlier.
It's called a treadmill, motherfucker.
Well, that helps, right?
Shit.
Phentermine, right? That's one of them. Which is like it's like it increases your heart rate, your metabolism, caloric. But at the end of the day, man, that's a small part of it.
Right. Yeah.
It's your lifestyle has changed completely, right?
It's more nutrition, right?
Nutrition. 80% of it.
We
is
love food.
nutrition. Yeah, I mean, I love food too, man. I love drinking beer, right? But I gotta make sure, like, hey, I gotta do this. But at the end of the day, I still gotta pay my dues, right?
Yeah.
And my dues are to hit the gym in the mornings, 5 in the morning, and get it out of the way. Because after that, my day, I'm sure, like you guys, the rest of the day is not my day. It's
right.
My boy gets out of school or I get home. There's stuff to do at home, honey-do lists,
right?
Or at the office, there's always something. So it's hard. I make sure I get in the mornings, because if not, the rest of the day is not. I don't know what's gonna happen, right? But that's small changes we do or small sacrifices that we have to make, right? To make sure that we
longevity.
Yeah, exactly.
That's a big sacrifice. 5 in the morning.
Yeah, it's hard, man. This morning was nice. It was cold, man. That bed was nice and warm.
Yeah,
man.
fuck yeah.
I'm more of a night owl. So.
Yeah. How many? Like in your workout week? Like how many times can you push a workout back? Like that, and still feel fucking confident that you'll.
But like, damn, I got to work out all day today. I hope 7.
I'm in the gym for 8 hours a day. Son of a bitch.
I mean, it's tough, man. It's just you have to figure it out, your schedule, right, and work around that. That's but if you want anything, Matt, if you want anything, you're gonna do what you got to do to get there, right.
Like right now, are you lifting for size
I'm just lifting
or just to maintain or
to be healthy and be somewhat strong, right? But not for size anymore. I'm 41, it's like and don't believe it or not, I mean the wear and tear, the 21 years that I put in my body, everything hurts, right? So right now I just want to make sure that I stay healthy, and be able to move around free, without just
fuck
hurting
somebody up.
Yeah. That's it. Yeah, but that's what you want, right? Like throw somebody against the wall and move on, right?
Man, grocery store the grocery store gets very violent, man. Fuck that shit.
We get all kinds
I get cut off. Fuck that.
Somebody going to jail. Oh shit. So, yeah, because I'm trying to find on the nutritional side, like how can you deep fry something healthy where it's not bad for you? You know what I mean? That's what I'm trying to.
Air fryer, man. Air fryers now.
That's what I'm trying to get at.
Man, you got to get that good air fryer. I got that bullshit one. It didn't
It's a
work.
microwave,
It was
God.
like soggy and shit. I was like, nah.
Yeah, no good, man.
Yeah, no, because like I know we used to do like boxing workouts. We used to do that. I used to do that.
Wow.
It was a P15X. P15X.
Billy Blanks.
Yeah, Billy Blanks.
And left. And right.
And then I used to do like those HIIT workouts, which is something that I prefer as opposed to just the regular. I can't do the gym. I can't.
I can't do HIIT workouts, dude.
No,
Like,
no.
My joints, all that shit.
I'd
it
be wanting to
fucks
throw
me
up.
man. That's why to me, the lifting weights, it's a lot easier.
You see, I just get bored doing that.
Lifting weights?
Yeah, just because it seems like
Put more
You're at the wrong
fucking
gym.
weight.
yeah. So, no, so
You're at the
it's-
wrong gym.
So I equate it to this. Like I hate fucking running, right? Because there's people that could just go on straight 4-mile run to come back.
I think you just hate
I
exercise.
hate no. Listen to where I'm going with this. Like I hate running because I don't see a point because I'm going from A to B, B to A, right? As opposed to like when you're playing football, you're doing all this running, but there's something at the end of it, right? There's like a goal to it. You're trying to get to the end zone. You're trying to catch a ball. You're trying to outrun people. So I think for my sake, I have to have
A goal?
a goal or like a reward as opposed to
check this out, man.
just sitting
Losing
there.
weight, that's the goal, man.
Hey,
but I mean-
go to the gym at peak hours. There's a lot of sights to see, and then you get motivated, bro.
There's the
You
motivation.
get on the treadmill behind somebody, and you just look forward. And
No,
just-
you see-
you're running
You know what?
towards something.
Like, I don't know if you have this in your business. Like, just take a picture of a person without their shirt.
Yeah.
And then, like, Photoshop it into what it could be, and then print that shit out, and then have him post it in front of his wall. Like,
I like
that's
that.
my goal right there.
Yep.
No, I'll just
That's
have
what
that.
that's what I want to look like.
This is how I looked last week.
I'll post that shit on Facebook.
right.
Like that's the way I look like now.
Right? Yeah.
I pulled my leg the other day, and I went to shit.
I pulled my hamstring last week, and look at it now. I'm all fucked up.
Dude, I
This
turn
is
off
me.
the lights when I take a shower. I don't even want to look at myself, bro. That's disgusting.
Took down all the mirrors.
Yeah, I'm like, there's no mirrors in my crib.
Straight darkness.
Just straight darkness.
Straight darkness.
I scare myself. I'm like, what the fuck is that? Look like some fucking alien. And shit. No
Yeah, dude,
ass. No ass.
That
Just legs.
should, that should be motivation. Though.
You see, but like I can't.
So it's
I have to be interactive.
talking motivation, right? So
Yeah.
if you like don't like running, right?
Right.
Which is cardio, right? Or
Yeah.
elliptical or any of those, bike even. There's the big one is CrossFit, right?
Mm-hmm.
If you can do that, like I know, like his joints hurt. My back is jacked, right?
Yeah.
So it's hard because there's a lot of those movements, right?
Jumping on a
But
box.
CrossFit is one of those things you can look into too,
Mm-hmm.
and that's has your cardio, but you also use weights in
Right.
your workout. So I mean, and there's a goal you got to get to. You know,
Yeah.
you always want to get your PR, right? Your record, right? You want to increase.
Right,
your
right,
weight
right,
all the time,
right.
So that's something you can look into too, and maybe
See,
that'll.
my only drawback with CrossFit is that because I don't like when it was a craze about like 6 years ago, that was like the thing, right? Fucking CrossFit.
Yeah, yeah.
But every time you'd see these guys, they were always hurt because it like you said, it hurts your
fucks their
fuck.
shit
Yeah,
up.
it fucks up your shit. So I prefer like the HIIT workouts because you're not going through all those crazy emotions like CrossFit,
Yeah.
but you're able to get a lot of the benefits, and you're basically burning your ass out in fucking 30 minutes, 40 minutes, as opposed to the hour of being there and doing all that. And for me, I think like I motivate myself when I'm doing
You got a 5-minute workout.
like when I'm in a group and I'm seeing this dude going like 95 miles, and I'm like, well, fuck, dude. This dude, I know he's got me by like 11 years, but I'm gonna try to catch up to this motherfucker.
Competitive, man.
Yeah, as opposed to just being there on my own and just be like looking around and shit and fucking.
You can still do that.
I
though.
can't do that.
And that's what I do because there's guys there that are fucking like way bigger than me and way stronger than me, and it's like that's my motivation. It's like I want to get to that.
You see, but
I mean,
we've-
and I see guys like way younger, like 16 years old. Like this motherfucker's lifting more than me.
Yeah.
and I'm like way older. I'm like,
Yeah.
I should be able to keep up with this guy. You know
See,
what I mean?
but we've talked about this because I hate that gym guy that you go in there and I'm like, all right, first of all, I got to find out what the fuck I got to do, right? Because I don't know shit.
Got to read the instructions on the gym.
So I'm there sitting on the machine. All right, you do this, you do that,
Okay.
and then you have these fucking 3 jackoffs that have been there fucking too long. They're done. All right, you got where you got to be. You're done. Fool. Just fucking go outside. Yeah. And they're there fucking slamming shit and fucking yelling. And I was like, dude, I don't want to hear all that shit. Yeah. I'm still trying to fucking.
That's what you
So
go.
you got to go to curves.
Yeah. That's what it is.
That's where we got to start curves.
You gotta go to Planet Fitness.
That's what it is.
illegal.
They
there.
got pizza
That's
night.
a, that's
Yeah.
a way. That's
That's
the.
illegal there.
That's illegal to do that.
Yeah, you can't be
Yeah.
grunting.
And then they
you
have
can't
pizza
be-
night
Shut
on
the fuck up
Fridays.
and
You
shit,
could go
yeah.
eat. You could go eat and work out.
They got pizza
dog.
night.
Yeah, pizza night.
Fucking throw up. Oh, fucking throw up mid workout. Yeah,
Because
because
man, like, all I hear is excuses from you.
I'm just
Yeah.
no. I'm just saying.
I want to
that's
do a
the
workout,
thing
but
need
what
to
I
do.
really hate
No.
is the drive.
I
I got to get in my car. And then
that's why-
when they turn the key,
Yeah, that's what's
I hate
that's
that.
when he
done.
mentioned that magic pill. He was like, boop.
Yeah,
What was
yeah.
that? Substitute for exercise?
Yeah. So the
Am I
more you
here-
sleep, the
am I-
bigger I get. Yeah, I'm the same way. I'm talking shit.
How much you bench? 18 hours, motherfucker. 18 hours.
Dude,
of
I've
straight
had
rest.
a gym membership for like 5 years. I got to go see if it's still active. I pay for it, but they probably changed the little chip now. I don't even know. Yeah.
It's been
And
outdated
I'm like,
and shit.
yeah. And I'm like, no, I need the 24-hour gym. What
Yeah.
the fuck? I don't need a gym. I need a fucking.
You need to go.
I need
That's
to
There's
go.
a difference.
No, let's say someone like him, for example, who hasn't worked out for like years.
Oh,
And
Shots fired.
if he wants to take that step, I know like one, it's gonna be motivation. Is there anything that he can take like for motivation to even like?
Yeah, what pill could I take?
Like to have the need to like start working out.
There's so we have you take pre-workout, right? So we have this injectable one, which is 3 aminos, right? L-arginine, L-citrulline, and something else.
He'll
right?
take a double.
You think so? It's like you have a pre-workout in you at all times, right? So you have that pump all the time. You have that energy to go at all times, right? Or you can go with get a shaker, put your pre-workout if you want, and
Right.
go that route. But sometimes that helps folks get going, or a cup of coffee even,
Yeah.
Like me,
Monsters.
my tolerance for caffeine is very.
It's high
little.
now. Oh, it's low.
No, I can't take. Have anxiety. I'm telling you, it's about me. Have anxiety as it is. So I got to watch my caffeine. intake.
Okay.
Because of that, right now I'm just like, dude, I'm having a panic attack just breathing.
Right.
But there's other things you can take to help you move on, and if you're like I said, that one amino, it's a tri-amino blend, which is like in the citrulline, the arginine, and I can't remember the last one, right? But you'll have that pre-workout at you at all times. You have that pump, you work out and you get that muscle fullness.
Yeah.
Like pretty much as soon as you start hitting the weights, right? But there's so many things, so many different supplements that we have that will definitely help you if needed, to help you kind of get you going initially, and then after that, man, you're gonna feel great. Like he said earlier, right? Like I'm like him. I go to the gym and I put my music in and I work out and I'm that's my happy place.
Yeah,
that's my therapy, right?
Yeah.
That's if I'm saying like it sets a tone for the day. If I don't have that knockdown morning, man, I feel like doo-doo. When
it becomes part of your life, it's something that you enjoy. So I would think that it releases endorphins, and it's like, so especially you, since you get started at the very beginning of your day, like the rest of your day is nothing but happy time.
That's it, man.
My happy time is eating. I love to eat. Okay.
You get that burrito.
I'm gonna go eat right now. You're making me hungry.
Shit, let's go.
The happy place.
Now we're talking about a workout, motherfucker.
Yeah, this is what I'm talking about.
All right, welcome to my gym, God.
And up, and down, and up.
But we also have, like I said, there's trainers available, right?
Yeah.
Our nutritional counselor, dude, she's awesome. She's a beast. She used to compete, so she's gonna lead you down the right way because she practices what she preaches, right?
Right.
So she will write down a plan for you, a workout or a meal plan, and if you want a workout plan, she does all that for the patients. It just takes that out of takes that extra
that extra step
thought,
out.
it's done for you. All you gotta do is follow it and do what she says. I'm telling you, man, and if you need a trainer to help motivate you throughout that, there's trainers as well that we can
one-stop
push
shop,
your way and that you have it all in one place.
Yeah. So I know, like, all this talk about the pre-workouts and all this fucking shit. The majority, from what I keep on reading, is what you need to do is sleep. Rest, right?
Of course.
Well, you got that down.
No, that's the thing. I don't sleep. My problem is I only get like 4 hours a day, if that. And I think that's what's fucking me up as well. On top of the the testosterone that's going down, and
I'm sick and tired of being sick and tired.
Yeah, I'm sick and tired of being tired. And I'm so fucking tired that I can't sleep. You know what I mean? That's the worst fucking feeling. Is there anything you guys recommend for that also, or is that anything that you guys do for that, or just get them tired on the workout?
Well, that's the plan, right? You want to like start your day off early, like me, for example, right?
Yeah.
Start off early. That way you kind of establish a routine, a daily routine. Go to the gym, go to workout, do what you got to do, some little errands. By the time we get home, it's like 6, 7 p.m. It's time to, give my boy a bath, get some dinner. By 8:30, 9 o'clock, he has a routine too, right? So he goes to sleep, so he gets his full 8 hours plus.
Right.
But what I think is your routine,
it's in flux.
Always. You got to flip it. You know what I'm saying? It's so irregular.
Like today, I only
can't get in a routine.
Yeah, like today, I was asleep at 6:30. I got about 2.5 hours.
I think that's what has a lot to do with it on the rails, like your schedule.
Yeah. And I agree with that, but and I think that's it. And it's weird because when I would work out, and then at first when I would do the HIIT classes, right? I'd go do the HIIT classes, and I'd be exhausted before going in there. But now I'm like, all right, I'm gonna do this class. And I'm gonna be so fucking tired afterwards that I'm asleep. And nope, I was fucking wired, fucking awake all fucking day after that.
Like I said, you have the endorphins being released. You feel great. You have the blood pumping. That pump, and you feel great. So that's the point, right? You get it off, get it out. Obviously, your schedule has a lot to do with it, right? But you have to work your schedule and fit it in there somewhere. That way, your rest of the day. And by the time you get to bed, you're gonna get your 8 hours, at least 8 hours, 6 to 8 hours, right?
I get about 8 hours a week. That's about where I'm at right now. So
because I think the important thing is it's to make it a priority.
It is. Yes.
It's
to sleep.
To sleep, yes.
Yeah, I can't.
To sleep, it's to make it a priority because like with my wife, since we have a 11-month-old son.
Oh yeah, there's no sleep
and then,
there, dog.
With the whole pandemic, like just my mood, everything. I was just sluggish. I was just lethargic. I just had no energy whatsoever.
Right.
What little energy I had was like just to work out.
Yeah.
It was just like I wasn't giving my 100%.
Yeah.
I was just like gaining weight, getting fatter, and everything. So I told my wife, you know what? Like I need the gym.
Right.
Like I have to go to. I can't work out. Like I'm not the type of person to just like work out by myself, like in my house. Like it's just I get lazy.
Yeah, you do.
Now when it comes to the gym, it's just that you see all the weights, everything. You just get motivated. Like at least that's the way I am.
Mm-hmm.
Like I like to like be able to like lift heavy weights. I like to be able to just get that blood flowing.
Right.
And so I told my wife, like, yeah, I need the gym. Like, and so when they opened back up, I started going back to the gym, and yeah, I started getting my motivation back. I wouldn't say I was depressed. It was just more like I was lethargic, just having no energy. And it was a horrible feeling.
That's where you're at right now, man.
Yeah,
It's been the last 20 years.
But yeah, once I got back to the gym, it was like a whole 180, and my mood was better and everything. And then I told my wife, we have to make it a priority. It's to get our sleep. And that was the hard thing for my wife, was because my son, there was a point where he would wake up like every 2 hours.
Mm-hmm.
And I worked midnights. So my wife was by herself, and she would wake up, she'd go to work at 6 a.m. So she wouldn't get any sleep. So finally our son, we managed to get him to sleep throughout the whole night. And she started to work out. And she started feeling better, started feeling more motivated. She had more energy. Yep. And I told her, we just have to make it a priority. Just because we have our son now, that we can't just lose ourselves. Like we have to make ourselves a priority as well. Right. And in turn, we'll become better parents for our son, because we'll be feeling better. We'll be more motivated. We won't be lazy all the time. And that's my goal. Like I'm in the same, I guess the same thing that you're talking about is I want to be healthy. I want to be physically able to perform with my son. My son, I want him to grow up, and if he wants to be like doing all kinds, if he wants to do football or basketball, whatever, I want to be there. Yep. And I'd be like, oh, you know what? No, later, some other time.
Yep.
Right. And I want to be able to keep up, right? Because I want to push him as well. Like I don't want him just to run over my ass. You know what I mean? So like
it's gonna happen.
Yeah.
It's gonna happen.
Yeah, because I'm in that mindset. Is like, hey man, I'm gonna swat the ball out of your hand so you can fucking shoot. You know what I mean?
It's gonna happen. It's a matter of time. You see, you see, again, like we said, we're playing the long man's game, right? I got you by what, like 10 years?
I don't know. How old are you?
42.
Yeah.
Yeah, so I got you by 10 years. So so I see where you're at, right? And you know, at that age, we were all there, right? In your 30s, like you said, we were fucking gun ho. I mean, that's when we were doing so think about it. That's when we were doing the boxing shit when I was about a little bit older than that, right? Because it was only, about 5 years ago? Yeah. 4 years ago. So I was already past that. And then you get to that point, right? And this is where you come in, Erik. This is where it's very important. And the reason that we wanted to have you on here, because I know as guys, you know, we have the much, especially here around the border town, right? We have the whole machismo that, I can do whatever the fuck I can, and nobody can, I don't need help. And no, this is where it comes into play, dude. Yep. We need something, right? Because the world is changing. Everything is technological now. And advancements in therapies and shit, like, you know, we had talked about, I was talking to you earlier about the sense deprivation tanks that my boy Rob used to have. Mm-hmm. You know, you had different kind of therapies, because now we're dealing with a lot more different shit, especially with Corona. Now that we're being fucking locked up for fucking, a 10-day curve is a fucking 18-month lockdown that we're on, or whatever the fuck it was.
Yeah. Past year,
yeah. So we're about to get locked down again.
Yeah, we're about to get locked down again, I bet. All of that, and we have so many questions, but as guys, if we don't look it up, we don't have somewhere to go. And I think it's important that you're offering these services to educate people and to get people back on the right side of doing things again. Right. So that's why it was important for me to bring you on, because I know we had talked about it. I know Jules and I had talked about actually going down and getting with you, and just shitting on me, so that way we can start doing what we got to do.
Right.
But again, so then it's Diamond Hormone Therapy. You're on, what's the address again, Montana?
So 10940 Montana, Suite A, 79936 zip code.
So if we want to set up an appointment, where's the number that we got to call? How do we go? Do we do it on the internet? Do we do it? How do we set it up?
So there's multiple ways. You can either look at the website, which is diamondhrt.com, or call our office. Is 915-303-8191. And Stephanie there, our medical assistant, will take your call and set up an appointment for you there. Or you can just go onto our Facebook or Instagram page. Look up Diamond HRT EPTX.
Okay.
And there's a link there where you can either call me, email me, or the office, and there's multiple ways you can set up, and we can set up an appointment within minutes and get you guys going.
You're like, what do you want to improve? Yeah,
Yes.
everything.
Yes,
Everything.
Check left.
Yeah. Do you have that one that cures everything?
Swipe right.
Yes.
Swipe right,
Yeah.
God. So this it's Monday through Friday, right? Or do you offer weekends as well?
So we're open Saturdays 8 to 12 because folks obviously work different schedules, right? And more 8 to 4, 8 to 5, 9 to 5 type schedules. So we're open on Saturdays from 8 to 12, those 4 hours, to try to capture those folks that just don't have the time or to get there. That's when we can get you in and get the blood draw.
Okay.
The good thing about this is our services. You come in for your blood draws initially. That's probably the only time, if any, that we'll see you.
Okay.
After that, it's all either if you're at work for some reason, you can't come in physically for your consult. We can set up all phone consults, right? And the doc will call you or nurse practitioner will call you. 30, 45 minutes is just you need to kind of have blocked off.
Yeah.
To go over that, and then after that, they'll give us the notes, whatever the treatment plan, the meds that are prescribed to you, we'll order them and have them shipped to your home, along with all the supplies. So it'll all be it's very discreet, right? And it's all
right.
You don't have to worry about anything. It's all taken care of. Just the only time that we'll need to see anybody is for the initial blood draw, and then obviously every 6 months after that for the blood draws. I can't do it any other way.
Yeah.
I don't have the mobile services yet. But that's a plan to get there because again, just the schedules.
Right.
Everybody has different schedules, right?
Yeah.
But that's pretty much that's how we can help you, especially with the time constraints that everybody has.
And the blood draws are all on site, or do you send out to a different site with the laboratory and all that?
So we do the blood draws there on site.
Okay.
But we send it off to San Antonio, a lab in San Antonio, and within 24 hours we'll have your results.
Okay. And then so how quick after the blood draw Dad, I can't even talk now. After the blood draw, do we start?
You got something for that?
Hey, can you get my brain going again? How quick after that do we get the set up the consult to start this shit? Like if I want to do this shit like ASAP.
Yeah, because he's gonna change his mind.
Yeah, because I'll change my mind. Yeah, because it's about 11:30, so by like 12, I'm gonna be like, nah, I'm good.
Because I'm gonna get my car and drive over there.
Yeah,
You know what I'm saying?
I'm on drive, man. On the drive.
Yeah.
On the drive. I'm on what we alcoholics call a moment of clarity. I want to be like, you know what? It was a good idea.
Yeah. So I want to go down that rabbit hole.
We had a good run. So before we close out the show, dude, because we're already at about an hour and change, what would you like to tell people about the services you guys give, or just in general, dude? What would you like to tell people?
And I think we've been talking about it the entire time. If it's just if you want to feel better, just to have a better, outlook on life, right? And kind of everything starts from how we feel, right? If we feel great, the rest of everything doesn't really matter, right?
Make your lady feel better,
right? There you go. That too, So
fuck it, I'm gonna say it.
Yeah. No, that's right. We help with erectile dysfunction, ED. Testosterone therapy for men, or hormone therapy for both men and women. Kind of weight loss stuff. If you need some weight loss, if you just need B12, right? For example, if you need a B12 shot, kind of helps you with the energy. Kind of going. We have that. If one day you go out and have a rough night and long day of drinking, right? And you need an IV, we have cocktails for that to kind of
really.
Yeah, we have that. You come in. We set you up with an IV, and within 30, 45 minutes,
you're good to go.
You're good to go, and you feel that.
Go drink again.
Put this shit to work.
Right? So we have a multitude of services that we provide there. Like I said, if you go onto our website at diamondhrt.com, you'll see our plans there and our different services that we provide. And there's FAQs there as well that other folks have asked that we've posted on there with the answers. And if you still feel like there's a question that's not answered, you can just give us a call there or shoot me a message, and I'm pretty responsive to answer those questions. So you have the answer right away. You're not out there like kind of just like, thinking or reading other stuff, right? We'll give you the answer that comes straight from our doc, our providers, right? That way it's legitimate. It's not just some I'm coming up with some crazy answer, right?
Right.
But those are some services that we do there. Like I said, again, with nutritional counseling. If you need workouts, gym access, we have gym access as well. Some folks live on the west side of El Paso. Like there's a clinic on the west side that you can go over there too. And they have.
You have access to that one too.
We do. Yeah, we do. So it's just you got to call. You just got to give us a call or shoot us an email or text, and we can definitely get you started and get you going, and hopefully get you out there, and you'll see within 60, 90 days definitely the improvement in your life,
and the quality of life.
Yeah, you feel better.
Quick question. Now, some of your services, are they covered by insurance, or is it all just
So
private?
all out of pocket. What you can use for insurance is your blood draws.
Blood draws, okay.
All you're responsible for is your copay.
Okay.
Your copay is that's your responsibility. But if you want to use insurance for blood draws, you definitely can. But everything else is out of pocket.
Out of pocket. Okay.
Yeah.
Okay.
Damn, I'm gonna be taking like 40 fucking pills from the sound of it. No fucking cocktail of pills.
No, honestly, man, you think what you want to achieve. I mean, I'm pretty sure just from my experience working with our providers, you'll have the 2 injections, man.
That's it. Damn.
Anally.
Big ass fucking pellets, man.
Or pellets. Once
fuck around with a big ass pellet in my ass.
Get the injection. Hot beef injection.
Those are great though. They said those are great though. It's just because you have it in your system at all times, and it's a slow release.
Yeah.
So I've had many folks or patients say they feel better with pellets than injection. But everyone is different, right?
Right.
So you just got to try it out, trial and error, and see what works out for you.
Yeah, because according to my lady, I got a lot of ass, and I don't like fucking taking shots in my ass or fucking. I ain't trying to do that.
You gonna take it? All of it. The whole thing.
Yeah.
You got an extra long
All
one.
right. So that when they tell me go work out, I say I am.
Can't you see me?
That's just burning right now, guys. Don't you see that shit? I'm fucking feeling the sweat.
Yeah, we need to hit that place up.
Yeah,
definitely
we definitely going to do it. That's diamondhrt.com, right?
Correct.
Diamondhrt.com. The boy's name is Erik. Thanks again for coming on. It's the Words on Fire on the IG, the Words on Fire podcast. Oh, the Words on Fire podcast on the IG, the wordsonfire.com. On all audio spots, like, subscribe, leave a comment on the YouTubers that were here somewhere. Subscribe, hit the bell notification, hit the thumbs up. Get a hold of this dude. If anything, at least answer some questions if you have, at the bare minimum, because it's that time, especially if you're around that age where you're starting to notice stuff, which I did. Like I said,
if you're under 30, fuck you.
Right, eat a dick.
Yeah.
Keep partying.
Yeah.
Yeah, but it's definitely good because, I mean, our mental health is good as our physical health, and if we're not here physically, we can't be here for those that are require us to be here. And I think this whole COVID thing actually has brought a lot of light to that. With the shit that we take for granted, something as simple as just working out, or, walking outside, just something simple like that, dude. Again, dude, appreciate you. The boy's name is Erik, diamondhrt.com. Get at him. Till next time, guys, don't be an asshole.
Don't be a dick.
Deuces.